Let's talk more about how best to use your clinical space, namely, the subject of measuring reserve space in your clinic versus the space that's actually utilized. We want to help you understand the full impact of provider signouts and unused real estate. Our tools take into account all of your clinic space, whether you call them pods, halls, or modules, and help determine which space is actively generating revenue and figure out how much it is actually being used. Often, the two biggest expenses in physician practice are rent and compensation. So let's make sure you're using all of your space before you add more. With our tools, we've found there's roughly a 20 to 30% disconnect between how much space is reserved and how much is actually used. That's a lot of expensive real estate left unused. Knowing how your practice utilizes space will allow you to make decisions about new space and when to recruit providers to help fill space, especially if you have wait times that indicate patient demand. When staffing within your clinic, you're most likely basing it off how much space is being reserved, as more space reserved usually equals more doctors seeing patients. What this doesn't take into account is that 20 to 30% disconnect. By tracing the correlation between reserved space and the space's actual utilization, our tools can discover how much staff your practice actually needs, thereby allowing you to make more accurate staffing plans. This closes the gap between the revenue from visits and expenses you're paying for unused space and unbalanced staffing plans. Asset utilization and deciding how best to use your staff and space are only a few of the wonders Arrowlytics utilizes to help optimize your practice so that there's as little wasted time or space as possible. If you want to learn more, visit our website where you can watch the remainder of our videos and discover the rest of Arrowlytics' phenomenal features.